Good afternoon, Toby. My name's Emma. I'm one of the specialist nurses here. Can I just ask you a couple of questions? Okay, lovely. Can you tell me where we are? What's this place? Do you know, we're at King's College Hospital. The thing about Toby, he's fluctuated, so there's times when he's a lot more alert than other times he's really drowsy. So it's ongoing delirium. And it's very distressing, not just for the patient, but also their families and staff as well.
I think the general public don't have an understanding of what patients go through. Some of our patients were in critical care for 40, 50 days. The impact that it had on them was huge. The thing that really struck me when they came out of the intensive care unit, some of them were so weak, they couldn't even hold a cup or a glass. They were really, really weak. And the fatigue with COVID is a lot worse than any other patient. They can't even go up the stairs.
See, once you do the first one, that's the hardest one over and done with. 1, 3, up. Good job. Yes. Well done.
It wasn't until after week 3 of first wave that we started to see this flow of patients waking up. And then we started to identify a large amount of problems. They were waking up with neurological conditions, cardiac conditions, sensory problems, visual problems.
Virtually every organ got affected by this illness. So not only did the lungs become affected for many days and often weeks and months sometimes, other organs like the kidneys, brain, gut, all got affected as well.
Toby has survived COVID, but he has been very severely affected by COVID. His kidneys failed, he has had strokes, he has had several cardiac arrests whilst being in hospital. He will not fully recover the brain function that he had before this. We're planning to discharge him with an awful lot of care and support in the community.
Wow.
It wasn't a nice thing COVID did at all. It was really changing. And sometimes I feel so selfish, like, oh, did I pray this person back to life to come and be in this shape?
So if we can do some more with your shoulders.
They need a lot of physiotherapy when they come out of intensive care.
And then I think we need to start trying some standing.
They need speech and language therapists. They need psychological therapy as well. It can take well up to a year, sometimes a bit longer, to get over intensive care and to get over COVID.
No, wait. Wait, gently, wait.
A large group of patients will potentially have a long disability for life. So rehab is going to be essential now going forward. We've never seen the number of patients in ICU that we've seen during wave 1. You've tripled the patient cohort, you've tripled the pressure on the services.
To get physiotherapy places for patients is really, really hard, and there's a long waiting list. It is pressure on the NHS, but in the long run, it's more cost effective.
So there's so many things to adjust to, and I'm still learning, to be fair, because before COVID, it was independent. He wasn't relying on someone to tell him, or do you want to listen to music, or do you want to or watch the news? Those are the kind of questions I ask him, really. But we are grateful for life and very hopeful. As we gather, Lord Jesus.